Today we are starting off with a new series, Post-Stroke Speech and Language Issues. I would like to start off with stroke and its causes. Brain, like all other parts of the body, needs blood supply through which oxygen and other required nutrients is provided. Brain is that part of the human body which is affected through a stroke. First, let's look into stroke or cerebrovascular accident. What is stroke or cerebrovascular accident? Stroke occurs when the blood supply to the brain is disrupted or interrupted. When this occurs, the blood supply to the brain is blocked, through which the oxygen and other required nutrients does not reach the brain cells, which results in the death of the cells within a certain amount of time. There are two types of stroke, ischemic stroke and hemorrhagic stroke. I would like to define it as a blockage or a bleed. Ischemic stroke occurs when the blood supply to the brain is blocked. It is because the blood vessels is blocked due to certain fatty deposits or debris which is carried through the blood and the blood vessels clog. Next, we are moving on to hemorrhagic stroke. Hemorrhagic stroke occurs when there is a rupture of the blood vessels and a bleed happens in the brain. There is one more term, that is transient ischemic attack, TIA, or mini stroke. This happens in a smaller amount of time and this shows much similar symptoms to a stroke. And this is not a permanent damage but a temporary one. Now we are moving on to the risk factors of stroke. Most of the time when stroke happens in an individual, there is an underlying cause. This is what we call as a risk factor. Factors that can increase the risk of happening of a stroke. It can be high blood pressure, high cholesterol, diabetes, excessive use of alcohol, smoking, etc. Age is also a risk factor of stroke. Individuals above the age of 55 are most likely to have a stroke. Studies show that men are having a greater risk of having a stroke than women. Personal and family history. Individuals who have a family history of stroke are more likely to have a stroke. Physical inactivity, obesity, and overweight can also be a factor for stroke. It is important to understand the risk factor and identify the symptoms so that we can prevent stroke. So let's learn more about stroke in the upcoming videos.